Why do senior golfers get wrist and elbow pain from fat shots? Imagine swinging your golf club and feeling a sudden jolt in your wrist or elbow. That discomfort often comes from fat shots, which are common among senior golfers. When you hit a fat shot, the club strikes the ground before hitting the ball, taking a chunk of turf. This causes the club head to decelerate quickly, sending a shockwave through your hands, wrists, and elbows. Over time, this repeated impact can lead to pain and even injuries. One reason for this pain is the increased impact forces during fat shots. When the club hits the ground first, it creates a sudden jolt that your muscles and tendons have to absorb. If your wrist is in a cupped position at impact, it makes it harder for your wrist to absorb these shocks, increasing strain on the tendons and joints. Many seniors develop this cupped wrist position because of trying to control their swing or compensate for reduced strength. Another factor is the steep angle of attack. Seniors often swing too steeply, digging into the turf more than necessary. This digging causes higher impact forces that your forearm muscles and elbow tendons must handle repeatedly. Over time, this overuse can lead to conditions like golfer's elbow, which causes pain on the inside of the elbow. Gripping the club too tightly is also common among seniors trying to maintain control. A tight grip increases tension in the forearm muscles. When combined with the force of a fat shot, this tension can irritate tendons around the elbow and wrist, leading to discomfort. Fat shots can also stress the tendons and cartilage in your wrist. Repeated impact or sudden jolts can cause inflammation, known as tendinitis, or even tears in the cartilage. The triangular fibrocartilage complex in the wrist can become inflamed or damaged, causing chronic wrist pain. In some cases, the impact during a fat shot can cause a fracture in the hamate bone in the wrist. This is more likely if you hit the ground hard, especially in cold weather when bones are more brittle. A hamate fracture causes sharp wrist pain and needs medical attention. To help reduce wrist and elbow pain, focus on improving your swing mechanics. Use a shallower angle of attack to avoid digging into the turf too much. Keep your wrists more neutral at impact instead of cupping them. Relax your grip slightly to reduce tension in your forearm muscles. Strengthening and stretching exercises for your wrist, forearm, and elbow can also build resilience. Practicing on softer ground or mats can lessen the shock from fat shots. And always give your body time to rest if you feel pain or inflammation. Taking these steps can help you enjoy your game more comfortably while reducing the risk of injury.